morning, everybody. I'm Dr. Alderman Arwady, Commissioner at the Chicago Department of Public Health. We're here to give a COVID update, and I am so pleased to be joined today by Pedro Martinez, this side, the new Chicago Public Schools CEO, as well as Alderman Scott, the chair of the Education Committee in City Council. So, per usual, we will be giving a COVID update with a particular focus on youth. I will also be providing some information about CPS and some of the data related there, and then I will be turning it over to CEO Martinez to provide some more context. So thank you all for your interest. We will start with some slides. As always, this data is available on chi.gov/COVID- and will also be posted after the press conference. So first of all, overall as a city, we are doing very well. We are averaging 343 cases per day. Yes, that is below the 400 case mark. And if you look at children, 0 to 17, we're averaging about 77 cases per day in children. So less than a quarter of our cases right now in that pediatric age group. We're averaging 26 hospitalizations per day. Again, a decrease from the prior week. If you look at hospitalizations in children, 0 to 17 years, it's less than 1 per day across the whole city of Chicago. And that has been true throughout this whole Delta surge. If we look at deaths, we're averaging between 4 and 5 COVID deaths in Chicago every day. Among children, that is 0 and has been 0. We have had 6 deaths total in 0 to 17-year-olds in Chicago from COVID throughout the whole pandemic, less than we see die from many, many other diseases. If we look at our testing rates, they're looking very good. We're averaging more than 18,000 tests a day, nearly what we were testing at the peak in November, and that has shown a good uptick related to students in particular. Our positivity rate, really pleased to say, is at 2.4%, down from 2.9% a week ago. Really looking good. And in terms of vaccinations, we continue to vaccinate approximately 3,800 to 4,000 vaccines every day in Chicago. We've been pleased to see that stay relatively stable, and it is the neighborhoods where we have the most room to grow that we are seeing the most vaccinations being done in. So everything looks good. Where we put our community numbers into that risk matrix, which I know you all are used to, you will see that our cases per day have now moved back down to the substantial transmission risk category, as defined by CDC, as defined in the same way in Chicago all along, meaning we're between that 200 and 400 number per day. And our other major metrics, including test positivity, hospital admissions, and ICU admissions, are also now in that lower transmission category. So at this point, we have gotten through this Delta surge to date beautifully, and so much better than most of the rest of the country. Our death rate is about 6 times, the United States death rate is about 6 times what our death rate is right now here in Chicago. Our case rates and positivity rates are less than half what the national average is. I also show these every week. This data is available on our dashboard, but I have to emphasize the difference here, where we are seeing cases, where we are seeing hospitalizations, and where we are seeing COVID deaths in Chicago. So disproportionately, we are seeing them in people who are unvaccinated. So as a reminder, when we look at this graph every week, that red line shows us Chicago residents who are unvaccinated against COVID, and the blue line shows us COVID cases in Chicagoans who are fully vaccinated. This is going back to March. And so you see on the left side of the graph, that first surge, that was our alpha surge. That was before we had fully reopened. And even then, we were seeing the great majority of the cases in the red category there, in Chicagoans who are not vaccinated. You see on the right side that increase, that's the Delta surge. And so we have seen some more breakthrough cases with this Delta surge because it is so much more transmissible. So that blue line represents breakthrough cases, but still and always, The much higher risk remains for Chicagoans who are unvaccinated. This same pattern follows for hospitalization rates. Again, this is our Chicago data, and you see that hospitalization rate so much higher among those who are unvaccinated, and the vaccine continues to protect beautifully. All of the vaccines continue to protect beautifully against hospitalization and death. The recommendation for the booster, just to remind you, for people over 65, people who are over age 50 with an underlying medical condition, is to help address more breakthroughs in that group, and people should get a booster if they fall in that group. But the overall, in terms of severe infections in Chicago and across the country, the news continues to be good. And finally, look at this difference in death rates. You've heard us say nationally, if you get COVID, you're about 11 times more likely to die if you are unvaccinated versus fully vaccinated. And there is no thing that is more important if you are worried about COVID, if you are worried about schools in COVID, if you are worried about grandparents in COVID, if you are worried about infants in COVID. There is nothing more important than making sure that all of the age-eligible Chicagoans in somebody's network are vaccinated. You've heard me say that there are specific groups when we look by race and ethnicity that are even more striking here, where we look at people in our 50s and 60s in Chicago who are Black and Latinx. The risk of death is approximately 50 times higher for people who are unvaccinated versus fully vaccinated. I know not everybody is convinced by data in the way I am, but my team is also hearing these stories every single day of people who are hospitalized and people who are dying, and their families are saying, I wish we'd gotten vaccinated. I was going to get vaccinated. I was just waiting. The great majority of these are preventable if people get vaccinated. And I know I've been saying this for months, but it just remains the most important thing. I want to highlight that COVID testing has more than doubled among Chicago children since CPS reopened. So on this graph here, and you can find this on the dashboard, the blue and all of the figures represent Chicagoans 0 to 17 years old. So you can see relatively testing in Chicago children along the pandemic has been on the lower side. But when we came back to school, and we just used the CPS reopening date, but this reflects all children being tested across Chicago, we've seen more than a 2.4 times increase, which means we would expect to be seeing more cases of COVID detected in this age group. 15% of our COVID tests performed during the Delta wave and 23% across the city since that date of CPS reopening have been in children 0 to 17. And you see that compares to only about 9% of total tests during the pandemic and about 7% during last winter's second surge. So this much better availability of testing is especially in children. And that's good because we know younger children have not yet had the opportunity to be vaccinated. We also are seeing a lot of testing happening in school settings. In the context of testing more than doubling in the 0 to 17 group, we, however, have not seen major surges or surprises in terms of cases in this group. Again, the blue line here represents 0 to 17-year-olds across all of Chicago, and you see, and the other colored lines represent the other ages. You can check the dashboard. You see that 0 to 17-year-old pattern of cases absolutely reflects what we are seeing in the community. Again, less than 1/4 of Chicago's cases, 22% since CPS has reopened, have been in that 0 to 17-year-old age group. Our COVID case rate in Chicago remains highest in 30 to 39-year-old Chicagoans. And the dark blue here is the 0 to 17-year-olds. We're averaging 14 per 100,000 per day. And similar to what we're seeing people in their 20s. And again, the biggest risk factor for all of these is unvaccinated. As I mentioned, the COVID hospitalization rate, very low for children 0 to 17, averaging less than 1 admission per day. This is, again, by age. The dark blue is the 0 to 17. At the bottom there, you see this has been flat throughout this surge and remains so. So As we look at a little bit of the more specific CPS data, you'll be hearing in a moment some of the updates and the real progress, really amazing work that is being done to ensure that CPS and all of our schools across Chicago are safe. I thought I would put a little bit of the CPS numbers into some perspective for you. So when you go to the CPS website, cps.edu/COVID, we've worked to pull together all of the COVID resources, all of the COVID tests, all of the COVID data into one site so that everybody's able to access it with a goal toward transparency. You'll see a lot of numbers on there that might look scary. You'll see, for example, that where we look at the total number of cases that have been reported, we've got 1,101 students and 342 adults that have been reported as positive cases who were in school during a time they may have been infectious, meaning they were in school on a day that their symptoms started or 2 days before, or if they didn't have symptoms on the day their test or 2 days before. And there's been that number is a little bit greater because we are adding things to that dashboard, and CPS is adding cases to that dashboard just as soon as we are hearing about them, as opposed to waiting to do the full investigation. So there could be some duplicates there. The numbers may change, but for transparency, felt it was important to put all of the actionable cases, including ones the Chicago Department of Public Health has heard about and the ones that CPS has heard about. And I want to remind parents and guardians that if your child is testing positive, please call CPS and let them know, because we get the test results at the health department, but we know there are some people doing home tests. We know there are some people saying, oh, does it really matter if my child is quarantined? Please, to help protect everybody, contact CPS if your child has a test. We'd rather hear from you, even if we already know about it. But in the context of hearing that there have been about 1,500 cases then diagnosed across CPS schools since the beginning of the school year, I want to remind you that CPS is the size of a not so small city. And so where we put that into some context, we're seeing about 5 in 1,000 people in that CPS ecosystem being diagnosed with COVID. That is not an unexpected number. It is well in line with what we are seeing in other school districts, and it is not significantly out of line with what we are seeing at the community rate, despite there being quite a bit more testing. So nothing that I am seeing in those numbers is concerning to me. Obviously, when we see multiple cases in a school, we are investigating. The CPS case investigation and contact team is very focused on what's happening in the school. The Chicago Department of Public Health team is working on exposures that may have happened outside the school. We're happy to answer questions about that. But even with a lot of extra looking for cases and extra attention, the rates that we are seeing in schools are not unexpected, and the schools remain safe from a COVID perspective. I also wanted to highlight the other set of numbers that we see on the website. And that is related to screening testing. So there's been a lot of interest in screening testing. And let me differentiate. So the top numbers on the website are how many cases have been reported, okay? The screening testing is this testing that CPS has set up across the entire school system. So every single week, there is testing available as of tomorrow in every school every week. But that is not testing for if I have symptoms, I want to come in and get a test. That is testing of people who are in school with no sense that they have COVID. They do not have symptoms. We don't expect to see a lot of positive tests there. But that screening testing is what lets us feel confident that we are not missing spread, that there are not outbreaks that are going undetected, that all of the procedures and protocols that we have in place are working. And so if you look on the website there, across, as of yesterday, there had been 414 schools just this week, and my understanding is that will be all as of tomorrow. And you see that there have been 17 positive screening tests among 14,761 tests. So let me put that into some perspective. Means approximately 1 in 1,000 of those screening tests are coming back positive. Is that concerning? It's about what we would expect. New York City, for example, is seeing between 2 and 3 per 1,000 coming back positive. It's not a number that's surprising, and it lets us do additional investigation if it's warranted. So we'll have the opportunity to answer any additional questions that you have relating to the numbers that you're seeing on the dashboard. The last piece of data that I'll share with you is that we have done an analysis of the children who have been quarantined at CPS. So from the date CPS started back on August 30 through September 25th, there have been approximately 15,000 children that have been quarantined. As a reminder, quarantine does not mean they have been diagnosed with COVID. This is a healthy child who has been a close contact or a potential close contact to somebody with COVID. So the child or the staff with COVID has to isolate. But then as part of the contact tracing work, their close contacts go into quarantine. They don't attend school for that time period. So of those 15,000 children, subsequently, approximately 205 later had a positive COVID test. So what does that mean? That means of the children being quarantined in approximately the first month of school, 1.4% tested positive for COVID. This morning on the L, I was reading my email and I had a panicked email from a grandparent who said, my child is 11 years old and is in CPS and he's been sent home for quarantine. He has a 5-year-old brother, and can you please make an emergency exception and get him a vaccine early, because we don't have vaccines available yet for children under 12. I wrote back and I said, I hear your worry. I know what it is when your child is being told to quarantine, when you have spent perhaps a year and a half being worried about the exposure to COVID. But what I said to him was that if everybody in your grandchildren's network, all those adults, everybody age eligible has been vaccinated, you have done by far the most important thing in terms of limiting the risk for that child. And it is true that that child could develop COVID, but chances are 98% of the children that have gone into quarantine from CPS have not. Only 1.4%, and that's all tests. Everything that's been reported to the Chicago Department of Public Health, everything that parents have called into CPS. When in doubt, we are counting it, even while the investigation is going on. So I want to reassure you that the procedures and protocols that the Chicago Public Schools has in place are working. Major investments have been made in terms of air handling. That was done last year, millions of dollars, and industrial hygienists in place to make sure those environmental things were in place. The testing that is happening, the screening testing, is available across the network, and we're not seeing anything unexpected in those numbers. And the cases that we are seeing reflect case rates in the community. We have not seen a single outbreak in a CPS school using our typical definition of outbreak, which is 5 cases or more. The Illinois Department of Public Health has asked to report if we're seeing even 2 cases in a school. And there have been some of these clusters, 2 cases, 3 cases, 4 cases. But when I read my email, or sometimes when I see some of what's being reported in the media, I think people worry that there are enormous outbreaks, hundreds of kids, thousands of infections, and a lot of spread within school. We absolutely are not seeing it. The universal masking in place, the requirement for staff to be vaccinated are the 2 most important things, and having everybody at home who is possible to be vaccinated is the most important thing of all to ensure we continue to keep our children safe. 312-746-4835. That is the number anybody in the city of Chicago may call. We will set you up with whatever vaccine you are interested in at a pharmacy, at a doctor's office. We will also bring vaccine to your house free of charge. We'll bring Johnson & Johnson. We'll bring Pfizer. It's open to everybody over the age of 12. No cost, no insurance, nothing. Give us a call or go to chai.gov/COVIDvax. Please get vaccinated today. No matter who you are, if you're in Chicago, you're helping keep our kids safe. And with that, I will bring up, really pleased to bring up Pedro Martinez.
So first of all, I just have to acknowledge, I mean, having a partner like Dr. Arwady, it is priceless. Somebody who has her credibility, who's very data-driven, who is looking at the information. This is not about opinion. And so first of all, thank you, Dr. Awadi, because you truly are an asset for us. But more importantly, you will be the voice of facts and what is actually happening in our schools. Para mí, no hay nada más importante de que nuestros padres sepan que nuestras escuelas están seguras. Toda la información que estamos mirando ahorita, que la doctora Awadi está mirando, está diciendo lo mismo. Las escuelas están seguras. There's nothing more important that parents need to hear, that the data that Dr. Awadi is seeing says a consistent message. The schools are safe. Are there things to improve on? Absolutely. Absolutely. And we will own that. Nosotros sabemos ahorita que sí tenemos que mejorar. Hay cosas que tenemos que mejorar. Por ejemplo, we need to make sure, and I am happy that we now have COVID testing available at all the schools as of the end of this week. That's step one. The next step is we got to get our staff and our parents to sign the consent forms and to participate, right? Because the better the data, the stronger it is, the more assurance that both Dr. Arwady and I are going to have that we can then use that information and make adjustments as we need to. But we are all learning, everybody. We got to give ourselves some grace. We have to understand that this whole world is trying to understand this pandemic. And so please, what I would ask of all of you is let's be responsible in reporting facts. Let's be responsible in trying to help me, please, to reduce the anxiety in our community. Para mí lo más importante, quiero que reducir la ansiedad de nuestra comunidad. Porque yo sé ahorita que nuestros padres están muy nerviosos. I know our staff are very nervous. Our parents are very nervous. I feel it. I get it. I am a father of a soon-to-be 11-year-old and a 7-year-old. Both have a history of challenges with asthma. My children have been in school every day. They will be in school every day in CPS schools. As a father, as a CEO, I will not allow our children not to be in a safe space, not our staff not to be in a safe space. But overall, collectively, what we're seeing is the schools are safe. But my priority number one right now is to ensure that our safety procedures get strengthened. Any areas we need to improve on, that is number one priority. So participation rates in COVID testing will be a top priority. I'll be working with the schools directly on how do we make it easy for parents. Contact tracing. We're getting close now. We're getting close so that the vast majority of contact tracing can happen within 48 hours. We're still building that infrastructure. And look, I know things have happened in the past. I am here now. I own this now. And we're going to, again, make this better. Para nuestras familias, lo que quiero que escuchen, lo más importante ahorita, tienen que recibir sus vacunas. There is nothing more important right now, though, than all of our eligible community members receiving their vaccines. We have such amazing resources, so accessible to our families. By the way, this does not exist in every city in the country. It doesn't exist in every country. We need to make sure that our families are listening and that they know how accessible these vaccines are. Pero nuestras familias tienen que saber que las vacunas son lo más importante ahorita para que todos estén seguros. That is the way you're going to keep your children safe, is to ensure that adults are vaccinated. And I am hopeful as we get more of our 12-year-olds and up vaccinated. We still have a lot of work there. I am hopeful about the next round of 5 to 11-year-olds. That is, as a parent, that's what I'm watching for. In fact, I ask Dr. Awadi constantly, what do you think? What week? Because I think it's weeks. I'm hoping it's not months. I'm hoping it's weeks. But again, we will watch that. And we will do everything in our power to ensure that we make it as accessible to our families, that we help them understand that they're provided the information. Lo que quiero ahorita, que la esperanza que tengo es que en unas semanas o en los próximos meses vamos a tener la oportunidad para tener vacunas para niños de 5 a 11 años. Y eso para mí, como un padre de un niño que va a tener 11 años y una hija que tiene 7 años, es muy importante porque para mí eso me va a dar más seguridad. I know that that's going to give our families more security once our 5 to 11-year-olds are eligible for vaccines. But again, on our website, we'll be reporting now cases daily. We will be more complete. We will not only just show active cases, we'll show quarantine. Please give us some grace because it is daily. That means there'll be some cleanup of data. But we plan to do that. We will show, again, we will start, one of the things that I'm going to be joining Dr. Awadi on a weekly basis doing press events with you. And if I'm not available, at least it'll be somebody that I trust as a representative of me, but I'm going to try to make it be me to give you consistent updates of what we're learning, what we're seeing week to week on schools, whether it's cases, quarantine, because I want our community to know that we want to share with you what we're learning. Frankly, what, maybe when we have to pivot, and I think the best way to do that is to work with you so that information is out there every single week. And if we see challenges, every week we have to be accountable to you about what changes we're making. So that is something that's going to begin next week. Sorry, just making sure that I didn't miss anything. But again, when I see the data, it's just so compelling. And for me, like I said, I can't emphasize enough, having the resources we have here, having the partnership with the Department of Health, it is invaluable. It makes me feel confident. It makes me feel confident that we're going to navigate through this, but we need your help. We need your help. Help me, please, to reduce the anxiety. Hold me accountable. Hold me accountable when things don't go right. But please, I just ask, let's try to help our community understand the facts, what is happening. We will address individual school issues as I see them. That's happening right now as we speak. But then I'm going to invite Alderman Scott to come up. Thank you, sir.
Good morning, everybody. I'm Alderman Michael Scott, Jr., Alderman of 24th Ward and Chair of the Education Department. I am very reassured about the response that CPS is having towards COVID. I've talked to CEO Martinez several times, and Dr. Arwady said today the numbers and the measures that are in place are strengthening the things that are happening at CPS. And as a parent, more so than an alderman and a public servant, as a parent, that gives me comfort. I am supportive of this work, and I will continue to work with Dr. Martinez and Dr. Arwady to make sure that our parents and our students and our school communities kind of know what's going on. Look forward to all of these changes that are coming here to CPS. That the dashboard that Dr. Martinez talked about and Dr. Awadi, the COVID testing in the schools weekly is something that is really important. And more so, I want to welcome him here to Chicago. He has been a stalwart in every place that he's been, and he has been a champion already here in Chicago. Had a magnificent first day yesterday touring our schools, and I just look forward to the leadership that he brings and the response that he brings to COVID. And so with that, I'll turn it over to questions for CEO Martinez and Dr. Arwady.
Thanks, everybody. We got a big group, so if we can limit it to one question and a follow-up, please. Alejandra has the microphone here.
Thank you. Hi, I'm Mila Kumpalova with Chalk Beach, Chicago. A question for CEO Martinez. There has been some chatter on social media this morning that something the district is considering is perhaps expanding its virtual option to more families and making that more widely available. Is that part of the conversation as you're stepping into your new role in the district, and what might that look like?
Yeah, so this is the commitment I will make to you. I know anxiety is high right now. So I don't think it's fair for us to say that we can't expand, we can look at expanding remote options. But let me be clear. We know we know the data very clearly. I know it from my former state. Children that were learning remote last year did not do well academically. Their mental health, their social and emotional well-being suffered. We are still learning what the impacts of that are going to be. So I want to make that very clear. But I also want to understand. I want to make sure that I'm hearing our parents that are very, very anxious right now. And I've learned a lot just from my previous experience with COVID. So I am going to be looking at what is our capacity to expand remote options. If we can accommodate our families, I would like to do that. Especially as we're all waiting anxiously for vaccines to come in for 5 to 11-year-olds. And so that is something that I've committed that I am going to be looking at in the next few days. And then again, I'll report what I'm learning, what our capacity is. For parents, just need to understand, to have a quality remote option, because we don't want to just have a remote option that is virtual babysitting. I am not in favor of that. To bring up a quality program, it takes time. So again, I will ask for grace, but I am looking at that right now. I'm asking those questions. I want to see what our capacity is, with the number one goal, reducing the anxiety for our parents.
May I just add one thing quickly to that? Is just to say that all along here in Chicago, we have seen COVID risk in schools be reflective of COVID risk in the community. And so right now, when our numbers are looking good here, they are also looking good in schools. We don't see different patterns of COVID risk in schools as we do out. We learned that locally here last fall, when, for example, the Archdiocese had thousands and thousands of people in school learning, and CPS did not have in school learning, and we actually saw lower rates of COVID in both students and staff who were in school. And so where we think about sort of risks and benefits, we're also thinking about, what does it mean for COVID safety? And certainly school is the primary the primary concern, but often I just want to remind people the number one place where we see children actually be infected with COVID is in the household, and particularly with exposure to people who are unvaccinated. And so I think, certainly this conversation is important, but there are some people, I think, who feel that that keeping their children remote will be the most important thing to keep them safe. But we sometimes see those same parents wanting to ensure their children have the social interactions that they need to have to grow, and we actually see more risk in those informal social interactions than we do in formal school settings where all the mitigations are in place. So it's a nuanced discussion, and certainly, as you know, where children are medically fragile, it of course makes sense, and we continue to discuss it.
Hi, Nader Issa with the Chicago Sun-Times. CEO Martinez, welcome, and congrats on the new job. A lot of parents, just on the ground, teachers, they might not necessarily care or know what's going on at the top of CPS leadership, and they just want to see their problems fixed. What can you do to assure parents, assure families that you're coming in now, the problems will be fixed? You said it's your responsibility. What can you do to assure them that you have this under control?
The number one thing is, first of all, us being very transparent, having a clear communication line both to our community, to our parents. In fact, we're having virtual meetings with all of our principals to really have, and we're going to be doing it on a regular basis. And frankly, we're going to home in on where we're seeing challenges. And so the best way for me that I know how to do this is it's just literally rolling up the sleeves and addressing the issues. And by us having, again, weekly report outs to you, I think it's another level of accountability so that we can share with you. And it's two-way, right? I know you're not afraid to ask the tough questions. And so it's two-way. It's a way for us to be accountable, but also to be responsive to what's going on. Again, the only thing I ask is, let's make sure we lead with facts. Let's make sure, because for me right now, it's separating the actual issues that need to be addressed, but also, for me, it's reducing the anxiety. And both things are equally as important. And again, like I said, for me, we can't do that by ourselves. We need to all work together on that. That has to be our goal, is to reduce the anxiety, but still hold us accountable. Hold us accountable to fix the things that need to be fixed. And we're going to roll up our sleeves, go school by school, work directly with the principals, whether it's more resources, whether it's strengthening safety procedures, clarifying communication. Those are all my top priorities right now.
This is for Mr. Martinez. Thank you for taking our questions. I was wondering if reaching a safety agreement with the CTU is something that's important that might bring some more trust, and it also might, stop some of the sort of complaints that are coming in, because they have a lot of complaints.
Absolutely. I mean, nobody wants that more than me and my staff to have that agreement. And so that's something also that I'm diving deep to understand, again, where's already agreement, right? There's some things that we already agree on. One of the areas that is a concern to me, and I just want to call it out, is their desire to have 6 feet social distancing versus 3 feet social distancing. And Dr. Awadi, you're probably much more qualified for me to talk about this, but the facts are, for us to try to do 6 feet social distancing, and what the CDC has said, with children, now with adults, they prefer 6 feet social distancing, but with children, 3 feet has been now the new standard. It is not possible to keep all the schools open with 6 feet social distancing. And so I call that out, because again, if our number one goal, and this is my number one goal, is to have our children in school, in person, in a safe space, learning, because I know that's the best environment for learning. And as Dr. Awadi said, there are more risks when they're actually remote. With COVID, academically, and their social and emotional. So we all have to agree that that's the goal. We can, again, work together on solving specific issues at specific schools. We're a large district, right? We're not going to get it all right. That's the one area that I'm concerned about, that we have to, again, use the science, follow the CDC, can't be about politics. But look, I will sign it, and I know, my team, we're ready to sign today if we can get to, get those pieces in place that we all agree on. That's the only area that I've seen right now that concerns me. That again, it's not realistic, and frankly, it's not aligned with the science, and it's not aligned with the CDC guidelines.
One other question. I'm wondering, and this could be for either of you, is there a moment that you do think that parents should be anxious? Like, are there enough, when 60% of a school is quarantined, when there's 8 cases over 2 weeks, I mean, to say that doesn't make you anxious, if I'm a parent, I feel like I'd be anxious. And so I wonder, like, is there a point where it's justified to be anxious?
Yeah, thank you for that question. I feel very strongly, right, for how worried people are right now. I want to also actually follow up on that first question that you had asked, where we're thinking about things like, when should you close a school, right? When should you be saying this is a setting where an entire school perhaps needs to go remote? And that is one of the other things that is under some discussion here. From my standpoint, it is not a number, right? There is a desire, for example, to say if there are 3 cases that are diagnosed in a school, the school should go remote. That does not make, to me, a lot of sort of sense in a scientific way, because say you have a school of 1,000 children and you have 3 positives, but none of those 3 positives are linked to each other, and you don't actually think there has been transmission within the school. The fact that there are 3 people there means that you need to quarantine those cohorts. But where we start to get concerned is where we see evidence of in-school transmission. And we will see some. So you heard me say right up top here, we've not seen to date in CPS, or actually any of our schools in Chicago since they've opened this fall, we've not seen any outbreaks, meaning 5 cases that have been linked in some way. We have seen some clusters. We've seen a 2, 4, right? And if we are seeing an outbreak, meaning there are a lot of cases that are potentially linked, and we think there's been some in-school transmission, that says to me something's not working well with the safety protocols in that school, and that would be the setting. But it's that within school transmission for me that is the major decision factor, because we are going to continue to see cases in school, and that will follow along with whatever our community numbers are doing. But in-school transmission, particularly at a high level, would be what we would be particularly concerned about and thinking. The CPS has been doing a lot of quarantining in these first few weeks to be extra cautious. You heard me say already that only 1.4% of the students who were quarantined ended up testing positive. So there may be room, even as we move ahead. We've seen this with school districts that opened before Chicago, to even be shifting some of those quarantine protocols to really be making sure that we know people at higher risk need to quarantine. But for me, it's not about how many are quarantining. When you hear there's a lot of quarantining, it means there's been aggressive moves to make sure that anybody who is potentially exposed is at home. It's when you're hearing about a lot of cases, and more specifically, a lot of linked cases, an outbreak, right? Numbers that are there. The most common reason we find 2 cases in a school is because there are siblings who attend that school. That, again, the risk, the likelihood of that transmission is in the household more than it is in the school.
Dr. Arwady, may I ask you a question? Roseanne Tejas with Fox 32. And I wanted to ask you about the vaccination deadlines for city workers, police, fire, and teachers. First, can you tell me any update on deadlines and then how the vaccinations are progressing?
Sure. So, as you know, there have been a lot of ongoing conversations, particularly with a lot of the unions, and some of the details of that continue. But October 15th does remain the deadline for City of Chicago employees to be vaccinated. So I will remind people, actually, that means that tomorrow marks when, to be fully vaccinated. Say you were going to get a single-dose vaccine, Johnson & Johnson, you should get that tomorrow to not have to do anything else related to vaccination compliance. I will say there are going to be, at least initially, testing requirements for City of Chicago employees who are not vaccinated by the deadline, and we'll have more to share about how long that option may last as negotiations continue. But we also last week formally requested City of Chicago employees submit their vaccination requirements. We had previously done some surveys, certainly at the department level, at Chicago Department of Public Health, we've been doing some of this, but in terms of that formal HR-driven submit your vaccination record, that formal request went out last week. And so as we start to see people putting in their vaccination records, complying with that, we will have a better sense of what those numbers are. I don't expect to have anything to share publicly until at least that October 15th deadline, so that there is time for people to be putting in that information. But yes, if you are a City of Chicago employee, you need to be vaccinated. And I'll tell you that within Chicago Department of Public Health, for example, where we have health facilities, there are other federal rules, et cetera, as you know. And so we already have required, we have just a minuscule number of people who are not fully vaccinated. And while they are completing their vaccination, they are getting routine testing until that vaccination is complete. If, for example, they only got the first dose prior to the deadline we had set for CDPH healthcare facilities. So you'll see a little bit of variation, right, depending on the risk and the setting. But broadly, all City of Chicago employees, if you've been vaccinated and you haven't yet turned in your card or updated your data through the Human Resources portal, do that, because that's the largest group, actually, people who have done it but haven't actually had a chance to submit it. And if you haven't been vaccinated, please do it now. It just is going to save everybody a lot of hassle, and our goal, of course, is just to keep the workplace safe. It's nothing more than that. It's to keep you safe. It's to keep the workplace safe. It's to keep the City of Chicago residents that we all serve as City of Chicago employees safe. So I have no more goal than that. We know this is the most important thing for workplace safety. More than testing, more than distancing, it's vaccination. And different than in schools where we have children who are too young to be vaccinated, we don't have children who work for the City of Chicago. So people can submit medical or religious exemptions, of course, and those will be evaluated. But without an appropriate medical or religious exemption, you need to get vaccinated. Thank you.
Superintendente Martínez, esta pregunta ya soy Mariano Gilis de Univisión. Bienvenido, un gusto conocerlo. Esta pregunta la contestó en inglés al principio de la conferencia de prensa. Me gustaría que la contestara en español porque ayer usted se comprometía en nuestro noticiero en la noche a revisar el tema de la educación virtual y me preguntaba si a la luz de los datos que se han dado el día de hoy ha reconsiderado el argumento. ¿Qué opina sobre la educación virtual? ¿Sigue teniendo validez después de escuchar que la lucha contra el COVID en las escuelas públicas marcha bien?
Bueno, yo sé que ahorita muchos de nuestros padres todavía están nerviosos, ¿verdad? Todavía tienen mucha ansiedad. Así que por eso quiero mirar qué podemos hacer de opciones virtual. Pero para nuestros padres quiero que entiendan que lo que sabemos ahorita, que los niños que están en las escuelas en persona están más seguros cuando hablando de COVID, están más, van a aprender mejor. Y nosotros sabemos que el año pasado todos los niños que estaban virtual, muchos niños no tuvieron éxito académicamente, tuvieron muchas todavía estamos aprendiendo ahorita todo lo que pasó con nuestros niños, ¿verdad? Pero como yo sé que nuestros padres están nerviosos, tienen ansiedad, sí voy a mirar qué opciones podemos tener y esto lo voy a hacer en los próximos días, pero como dijo la doctora Awadi, tenemos que estar claros que el mejor lugar para nuestros niños es en persona y yo voy a asegurar que nuestras escuelas estén seguras, donde tengamos problemas, yo voy a trabajar para resolver esos problemas. I just said again that, in terms of the virtual option, just reinforcing what Dr. Awadi said, whether it's health in terms of COVID, their academic well-being, their mental well-being, in person in school is where children need to be. That's where they should be. But I'm recognizing that there's anxiety in our families. That's why at least I have to look at what we're able to do. And for me, it really is a bridge as our children become more eligible for vaccines, right? It really is a bridge. But again, I just want to be clear. The goal has to be, whether it's CTU negotiations, whether anything that we do, is how do we promote as much as we can that the best place for children to be is in person in our schools, and I will do whatever it takes to make sure that we resolve any issues that we see in our schools, whether it's safety procedures, improving COVID testing, improving contact tracing. That is my commitment.
Mugo Odigwe with CBS 2, and this question can go to either of you. But earlier, you talked about a screening testing that would now begin tomorrow for everyone at every school. But at the same time, a letter was sent out to parents, correct? 2 days ago, from what I'm seeing here, and it said that specifically for student athletes, that testing was going to be delayed for those student athletes. And that's considering the fact that fall sports has started. So what's the reason for that?
Sure.
Why is it behind?
Yeah, and let me clarify the question that you asked, because at this point, screening testing will be available in every school every week as of tomorrow. It does not mean that everybody is being tested in every school. That is not how screening testing works in any public health setting. This is not we're testing everybody repeatedly. We want testing across the schools to be able to monitor for any unrecognized spread or patterns that we're not expecting. So we definitely are not testing everybody every day or even every week. This is when CEO Martinez said he's encouraging parents to give the consent for their child to be tested. It is for that. It is for them with consent. They can be tested at the schools. We are now in all of the schools as of the end of this week. My understanding is that there will continue to be capacity growth in terms of testers, et cetera. This is not just a CPS. Schools all across the country have seen this huge demand, and there's a lot of need for additional staff and resources, et cetera. But the goal will be to make sure that now that all schools are in place, that every parent, for example, who is wanting to get their student tested, as long as it's sort of fitting in with the screening testing that we need, is able to access that. So related to the student athletes, I don't know the details of that, and I'm not sure if you know the details of the letter.
We'll get it for you.
But CPS can follow up there. I would just say that always, whenever our top priority is not the screening testing, because remember, that's everybody is asymptomatic and we're doing it. It's making sure we are responding to the actual diagnosed cases, and that is and remains the top priority. And any setting where we have concern, any school where there have been multiple cases, et cetera, CPS works hard to make sure that there is additional testing available very quickly and on site, including at home. We have partners who can come in and do some additional testing. And then we also work to make vaccination available, because sometimes when parents, to the earlier question, are concerned about hearing about cases in their school, we know sometimes that sort of makes people say, you know what, now maybe is the time to finally get vaccinated. So I hope that helps clarify the difference between the screening testing and sort of clinical testing when somebody has symptoms.
Thank you. That does clarify. Just one follow-up for Pedro Martinez. So right now it's not clear, or you can't answer the question about the delay in testing for student testing and proof of vaccination. It says it's going to be delayed.
Yeah, so let me follow up. Give me some grace. It's day 2, literally. So let me follow up, and then we'll get you that answer.
Hi, buenos días, Carla Leal con Telemundo Chicago, and my question was actually very similar regarding the screening testing. Maybe if CEO Martinez could explain to us in Spanish to help the parents ease their anxiety as to what does this screening testing entail, when is it done, how they opt in or opt out.
Sí. Para nuestros padres, quiero que sepan, uno de los más importantes cosas que podemos hacer es tener acceso a exámenes de COVID cada semana. So, es una vez a la semana para todos nuestros niños, pero solamente con la permisión de nuestros padres. Así que los padres tienen que firmar, y voy a mirar las formas para que sean fáciles, porque las formas, ahorita estoy mirando eso, para que sea fácil para los padres, pero es cada semana. Nomás el tiempo es 10-15 segundos, y vamos a hacer videos enseñando a niños que están haciendo los exámenes, para que miren los padres cómo están de fácil, pero lo bueno es que cada semana los padres van a saber y se pueden estar asegurados que van a recibir los resultados. Siempre vamos a proteger la privacidad de nuestros niños, pero los padres van a recibir esos resultados y van a saber que no tienen COVID. Y son para niños que no tienen síntomas. Si su niño tiene un síntoma, eso es otra cosa diferente. Eso queremos que también tomen un examen, pero no deberían estar en la escuela, ¿verdad? Si tienen síntomas. Podemos trabajar con la doctora Awadi para que reciban un examen, pero no en la escuela. Estos son para niños que no tienen síntomas. Y así podemos cachar casos, porque uno no sabe, ¿verdad?, que está positivo. Podemos alcanzar esos casos, trabajar con los padres para que sus niños reciban la ayuda que necesiten y para que todos estemos más seguros. I was just saying that it's really important for our families to understand that our COVID testing, our screening, is really for asymptomatic carriers. If you're symptomatic, you should not be in school. And we will work with you. We will get you the testing you need. Dr. Awadi does an amazing job of even doing home services. We will figure that out. Asymptomatic is really great to catch cases that, again, we don't know that they're positive. And it allows us to catch those cases, work with the families to make sure the families are getting the proper support they need for their child or for any other household members that might be affected. And so but it's weekly. One of the things that I'm going to work with our team is to even do videos for the families, because they're very quick. They're seconds. We protect the privacy of our parents. So the parents receive the results. Our medical professionals receive the results. We protect that, but it's just a great safety guard just to have, and it gives parents that assurance really every week that their children are not positive in COVID.
And can I just add, because we sometimes get this question, it is a nose swab, yes, but it is not the deep nose swabs that we were doing very early on in COVID. The testing has come forward to the point where it is a very quick nose swab that is not painful for the children or for the staff. So just to be clear on that.
CEO Martinez, can you talk more about the contact tracing effort? I'm seeing that you have doubled the number of contact tracers. How many do you have now? Is there some magic number that you're trying to reach, and how do you determine that?
I may ask one of my staff members to come up and just answer that directly, because again, it's day 2, everybody. So, here's Dr. Sweeney.
Hi, good morning, everyone. We have over 30 contact tracers whose full-time job is to do contact tracing. We have also about 30 other staff members who we've redeployed to make sure that we are responsive to all of the needs of contact tracing. To the earlier points that were mentioned, we are about 24 to 48 hours turnaround for contact tracing to make sure that we are connecting with families and reaching out to resolve all those issues as quickly as possible.
Is that enough for a district of this size?
We have multiple people who are ready to be deployed. multiple people within the organization are being trained in contact tracing. And what we're finding is we also refined the process. We looked at the questions, we've tweaked the questions to make sure that we are asking more intentional questions. We have seating charts for classrooms so we know exactly where people are during the school day. So that has reduced the amount of time that's needed to do contact tracing.
And just a question for Dr. Arwady. For families who have multiple children, and if one of those kids has to quarantine because of an exposure, what should parents do with the siblings? And should they also be required to stay at home?
Yeah, thank you very much for that question. No. And let me talk through the two different situations. If there is a person diagnosed with COVID in the city of Chicago, kid, adult, doesn't matter, everybody in that household who is unvaccinated should quarantine. Let me just repeat that because we often get this question. When there is a diagnosed case of COVID, child, adult, doesn't matter, everyone who is unvaccinated in that household should quarantine. So in the example that you've just asked me about, where we have a child who has perhaps been a contact at school and has been asked to quarantine, that child has not been diagnosed with COVID. They are not a positive case, and we do not do sort of sequential quarantining out from there. So there is not a requirement in the case of quarantine for other family members to also quarantine. When quarantine, and I know this is confusing, that's why I'm saying it a few times, and I'd love you to, if there's pieces people are not sure of, to help. And if people can always call the health department or CPS if they have questions. But the difference is, has somebody been diagnosed with COVID in that household? So if that child has been asked to quarantine and they subsequently develop COVID, then yes, the other children in that household would have to quarantine. But when a child is asked to come home from CPS for quarantine, it does not mean they have COVID. As you've heard, more than 98% of them don't have COVID. Children are less likely to spread, and there is not a requirement for the rest of the household to also quarantine. Does that make sense? Okay.
We got two more. Time for two more right up here.
Dr. Arwady, can you broadly expand on the CDPH investigation at Jensen? And two, when you say there's little evidence of in-school transmission, could you just walk us through how you arrive at that, especially if not every student's been tested?
Yeah, absolutely. So, and I like the way you frame that because it's sort of, here is the investigation and some of what we're thinking. As everybody recognizes, we have to protect individuals' privacy. And so I am never allowed to say this individual had this test result or this vaccination result per se. But here's some of what the team does, not just in that situation, but really in all situations. Whenever we're seeing even two cases in a school setting, we're working very closely with the CPS team. And they do have a lot of folks who were doing this last spring, a lot of experience with it. Just the numbers of how many students are in school has necessitated the need to bring some more staff in. But I agree that a lot of the efficiencies that we've been working on together over these last couple of weeks have brought us really to a place where that is happening with the appropriate time. I got a little off track there, sorry. So basically, when there's, remind me, just Jensen, yes. So always when we do an investigation, we're looking at any positive test results, anything reported to the health department, every test that is done in a doctor's office, a walk-in clinic, a pharmacy, anywhere in the city of Chicago by law is reported to the Chicago Department of Public Health. We're looking at those. We're also looking at any tests that a parent or guardian is reporting to CPS, because we know sometimes people are doing those at-home tests, or there may be other things. We consider tests positive when they are reported, period, in terms of public health action. And so we're looking at the dates of tests. We're looking at what the exposures potentially were in school. So when there is a test, we consider, we do the case investigation, and we say, when did this child or staff's symptoms start? We consider that they could have been spreading COVID potentially from not just the day their symptoms started, but 2 days before their symptoms started. If it is someone who does not have symptoms but has a positive test, we take the day of the positive test and also go back 2 days to have an expansive view of when it is potential that a child could have potentially transmitted in school. And then we look at if there's screening testing, we're layering that on. And then if there are multiple cases, like at Jensen, we will often work to do additional follow-up testing. So in this particular case, just to talk about it in some more context without giving away privacy details, we've looked at all available testing results for children as well as potential adults that could be associated. We have not found any definitive link in an adult outside of that school community to that school. You cannot 100% rule that out, but we don't have a definitive link at this time. And in the grade that is primarily of interest in that school, the very first day that CPS was notified that there was a child who was positive in that cohort, it happened to be a weekend, and that whole cohort, that grade, was transitioned to remote learning that same day, and parents were notified appropriately on the weekend. Those students in that cohort of interest were at home for that whole quarantine period. That same initial weekend, there was a second case that was called in from that same cohort, but for the rest of the time in quarantine, we've not had a single child reported positive in that cohort of interest. So the CPS policies were appropriate in terms of the case investigation and contact tracing that was done at the school level. We also followed up with CDPH to ensure that if a positive test was reported in an adult, that the appropriate case investigation and contact tracing had been done there, and it was. We do not always successfully complete case investigations. If people do not pick up the telephone, for example, we try multiple times and we document those, but we don't always have full information, particularly in the community setting if people do not participate. So the last thing is we look for connections among cases, and we literally do timelines of here is, this case and what was their potential infectious period. Where does that infectious period match up with other potential exposures within the school? And we are looking for likely transmission in school, less likely transmission in school. You can never 100% say, but like the example I gave at Jensen, there are multiple examples of siblings that have been diagnosed with COVID there. I think it's fair to say that without sharing too much detail, and not necessarily connected to the cases of interest. But that is part of what drives those numbers. And in those cases where it's a sibling, we would think it is more likely that transmission took place in the household. So in a setting like this, where we are seeing a high number of cases relatively compared to the number of cases in the school, CPS early on had determined that if 5 cases were being seen in a 14-day period, not necessarily even thought to be linked. There is some work that's happening with some of our academic testing partners here, Lurie Children's, for example, who can come in and offer an additional round of testing to everybody in that school community who wants it. And so the testing that was done yesterday through Lurie tested more than 100 children, more than 100 people at that school. And there were 2 borderline positives. And when we see borderline positives, it suggests that these are individuals who likely were positive in the past. These tests can stay positive for some time. We still treat them as positives, but they are unlikely to be infectious, and the teams are completing the investigation, but we believe those individuals to be linked to previously known household cases. So there was nothing in the follow-up testing that suggested that there was undetected or widespread or other examples of transmission within that school. I know that it is worrisome when you hear these kinds of numbers, and we pay extra attention too. It's why there's additional testing from CPS. The Lurie team is coming in, and my team, this is what we always do for outbreaks, by the way, or potential outbreaks. It's not different in CPS, but we pay extra attention. And so we continue to investigate, follow up, look at cases, but there is nothing at that school at this point that makes us feel that the school itself is unsafe. It is, I would just end by saying that it is, again, the most important thing is that we work to get everybody who is age eligible in the community vaccinated. That's going to be the most important thing in terms of protecting schools, students, and those individuals. So regardless of your age, if you're old enough to be caring for a child, you are presumably eligible for vaccination, and I would strongly urge you to help protect yourself and that child, always, regardless of the school setting, by getting vaccinated.
Last question.
It is a follow-up on Jensen, and I know that was a pretty lengthy explanation. You can't really get into, because of privacy issues. But the bottom line is, there were some pretty heavy accusations against CPS this week involving Jensen. Is there anything you want to clear up again about that school? I mean, the child of this mother that passed away, she was in quarantine. Did this child actually test positive?
So again, I can't provide specific results for an individual. I can tell you that in the cohort of interest, we did not have results of a positive test. I want to be very clear that we receive all tests that are done, as I said, in any clinical testing setting in Chicago. We also very strongly have asked, and again ask, that if there are home tests or other situations, that those are made known to CPS. And we've obviously looked very closely at that whole cohort. So can I say 100%? No, I cannot. One way or the other, and that's how it often is in COVID. But I can say that the appropriate procedures were followed in that primary cohort of interest where a large number of students were quarantined. After the initial two, at the time of quarantine, have positive test results in that cohort, which suggests not widespread or significant transmission. Possibility of some transmission is always there, and it's always going to be there.
Great, thank you, everybody.